By the way, just for your own use, if you ever want to remember the symptoms of mania, use the GRAPES acronym: grandiosity, racing thoughts, activity, pressured speech, elated mood, sleep. Not everybody finds acronyms useful, but if you do, this is one of the better ones. So when you are going through an assessment with a kid, you can kind of think about, have you ever had periods of time when you thought you were full of energy and had some great thoughts and great plans and things that other people didn't understand, or your thoughts were going a mile a minute? You were feeling happier than usual, on top of the world. Ever had a period like that? Ever had an interval? And when you couldn't sleep, did you feel like you needed to sleep the next day? Were you tired, or were you raring to go? These sorts of things can help you with an assessment of whether or not there's been a manic episode. We have a similar handout we use for depression. So let's say the main complaint is depression. So we'll ask the kid, what do you experience when you're depressed? What's it been like? What's low mood like? What's sadness like? Can you describe it? Is it the same as just feeling bummed, or is it something more? What about any of these others? Trouble concentrating, feeling fatigued, irritability, feeling worthless or guilty. And again, we'll ask the parents, have you ever seen this? Have you ever seen your daughter or your son acting this way? When you did, what did you do about it? Was there anything you thought was helpful? At what point did you decide to consult us as mental health professionals? Sometimes families will say, well, we know that this runs in the family, so we were wondering if she had bipolar disorder. More often it's, we had no idea what was going on. She seemed to be very upset. She was talking about suicide. We figured it had something to do with her boyfriend who she broke up with, and we just didn't know how to help. And often there is some sort of a trigger, like a life event, but it might still be a bipolar episode. That's one thing to keep in mind. Even if you can identify a very clear psychological trigger, traumatic event, a loss, it might still be an episode of the disorder. Another acronym, if you want to, I don't like this one as well, it's dig fast, depressed mood, interests, guilt feelings, fatigue, appetite disturbances, sleep disturbances, thoughts of suicide. Acronyms have a way of just sort of putting together, collecting information in case you ever forget what the signs of depression are. How many of you are asked to make a differential diagnosis in your work? Is that part of what you do? Okay, some of you do, some of you don't, but it's good in order to understand, is this really bipolar disorder, or is it one of the many comorbid conditions that might be present?